So I'm going to cover the single leg deadlift. I'm going to cover regressions and I'm going to cover how to gradually progress. So the importance of actually being strong and stable on one leg is, of course, at one point in the run, as we pull the leg through, we're going to be on one leg. Now, often we are very good at compensating. So for an example, if I'm stood here and this hip is supporting me, this leg can swing through very easily. If this hip is not supporting me, then, and it throws out, this leg, I can't pull it through. So what's possibly going to happen is this hip collapses, this leg's going to throw through. And I may be stable on this hip, so this leg can come straight through, or I may not be. We're not always the most symmetrical, so we want to be as close to having symmetrical strength as possible. So these are things that we need to look at. And if we have imbalances and we are strong in the less than optimal places, the risk of injury raises significantly. So what we need to look at is being strong. And we think about standing on one leg as being balanced. Yes, balance obviously comes into it, but it's about strength as well. So we need to reduce and minimize the compensations that we have. So as that demonstration I showed, the risk of knee injury, the risk of back injury, hip injury, overuse, osteoarthritis, potentially as we're getting older, we could be looking at wearing this hip out and maybe potential hip replacement. So it's very important to use your strength training to actually make you a better, more functional runner. So I'm going to show you a single leg deadlift with a weight, so kettlebell. Okay, I'm not going heavy. I've got to make sure my foot is firmly planted. So remember what I said on the, if you watch the foot video, why it's important to be in bare feet. I can feel the floor. I know I've got my foot set, I've got my arch, my toes in contact with the floor, and my arch is functionally raised there. That kettlebell is in front of that foot. So the idea of this is I haven't got any compensations. My hips remain level, this leg goes back, and as I turn and go back, that leg is going straight back. It's not going out, it's not going behind me. And if you notice, there's a very, very slight turn in, of the toes. And what I'm actually imagining on this heel, that I'm actually pushing something away from me. So I'm actually lengthening that leg. So what we don't want is all this weird compensation things. So this is the full single leg deadlift. My foot is planted. I'm not looking at the bell. I know where it is. I've just popped it there. What I'm going to do, make the long arms. This is engaged. I'm pushing that heel back. I'm turning in. I'm slowly there. Get hold of the kettlebell. Okay. I push that heel back. The leg's not going too far up. I can feel this glute working. There isn't any compensation. So I'm going to show you what we don't want. And then I'll show you how we can scale it back. So from here, the kettlebell's there. I'm not creating tension. My foot's not planted. You know, I'm just going all loosey-goosey. I'm coming back. Look where that leg's gone. That hip's throwing out. I'm off balance. I've got every compensation and I'm not bothering how I lift it. And I can actually feel that in my back. Okay. And that's only an 8 kilo. So what we need to do is actually think about everything. Think the setup is your first rep. So that's what we're aiming to get to. but we have several ways that we can get there. So this is where we can scale back to the athletic hip hinge. So I've got my cupboard there. I'm thinking about the hip hinge. Okay, so there's my athletic hip hinge. So all I'm going to do from here is transfer a little bit of weight onto this foot. I've got my strong foot, short foot, my toes are all in contact with the floor. I'm maintaining the arch. Okay, so from there, I'm going to slide the leg back. So if you're not on a floor, I will show you options that you have if you haven't got a floor that you can do this on. So from here, I've transferred a little bit more weight onto this hip, but without a complete sort of Saturday Night Fever hip. I'm sliding that foot back. Notice it's the same position and that foot is in contact with the floor. And I've come up to standing, okay? So I can slide that foot back, remove the hands or lightly keep them up, come up to standing. If you struggle to do that, put on fluffy socks. I've got some fluffy slippers here. Or just get a duster, polish your floors, okay? So I've got this here. I've got my athletic hip hinge. And lightly, I'm not clinging onto here for dear life. I've got 2 fingers resting on here. I slide that foot there and back. And I come up to standing, nice upright plank. So that's your first option of to regress it. The next one, you can actually use a wall to help the balance. But again, what we're still making sure that those toes stay in complete contact. So I do apologize. I'm going to turn and you're going to have to look at my butt. Sorry. So from here, I've got my position there. And what I'm doing is I'm lightly resting my hands on the wall. I'm going to that position, slide the foot back. I can feel this hip as loaded. It shouldn't be shifting out. It's as simple as that. And you should feel here. And once you're confident and you can do 5 to 10 on each side, then you can remove that from the wall and just sliding that back. It's just progressing at your rate and don't rush. And if you're training with somebody, don't try to keep up with them. It is your journey. It is about you. But I would always advise, if you do have an imbalance, even film yourself running, because often we have compensations that we don't know about. And those little niggles could be actually what is happening from a very simple compensation that you can correct with the correct strength training. Strength training should complement your running. It's not there to take over from it. And sometimes you may need to just adjust the running until you sort out any little imbalances that you may need to do. I hope this has been helpful. If you need any help, if you need anything, you can reach out to myself, to Kelly, or to Angie. So enjoy your training.